could be a very big job, but you got to understand, this fellow's cooperating with us 100%. We know when he came into the country, and as you've been talking about, we did track the Metro card, and it coincides with what he's been telling us. So we have no reason to believe that he's lying to us. You know, the first time he experienced fever, he called and came right in. So he was monitoring himself. He was taking his temperature twice a day. He's a doctor. He knew what to do. And as soon as he showed symptoms, he came to the hospital. So, you know, we are going to check on everything he says, but we have no reason to believe he's not telling us the truth.
Okay, so he said that for a while, that he self-quarantined. But, you know, when you listen to the press conference and you hear the movements that he self-quarantined and then he went into the subway where, you know, thousands upon thousands of people take every single day. He also went on the restaurant. He went to the High Line, which is very big for tourists from around the world. He went to a bowling alley. That bowling alley is now closed, and I would imagine they are going to do some sort of sanitizing of that bowling alley tomorrow. My question to you, as an official, an emergency official, should people who have treated Ebola patients or come in close contact with them, should they self-quarantine, or should there be better protocol for them not to be among the larger public for some time when they return?
Well, a self-monitoring is not a bad thing. We do active monitoring to people that aren't showing signs now. What's important is that at the first sign of some kind of symptoms, you get immediate help. You cannot spread the disease if you're not symptomatic. And the first sign of himself being symptomatic, he came to Bellevue. So, yeah, we're concerned. Again, all things being perfect, we wish he would have stayed in the apartment. He quarantined himself to some degree. He wasn't perfect. You're right. But at the first sign of a symptom, he came right to Bellevue Hospital, and we feel that is going to effectively stop him from being contagious to anyone else around him.
Okay. One of our doctors here, Dr. Van Telken, has a question for you. Go ahead, doctor.
I'm just very interested to know what you're going to be advising people who were in the public places that he was in terms of trains, in terms of the High Line, things like that. How far out would you be reaching into those populations?
Well, look, we may put out a message, but we don't feel we have to be alarmed because he was not symptomatic. Doc, you know he can't spread this unless he's symptomatic, and we're confident that he becomes symptomatic for the most part when he starts that fever today. He had no fever yesterday, had no fever this morning when he got up. He gets the fever late morning, maybe 10:30, 11 o'clock, and he calls in automatic immediately and gets transported to Bellevue by EMS. Okay,
so let me ask you this. Am I correct that they're going to be sanitizing the bowling alley, correct?
Well, we did not close that bowling alley. They closed it on their own. They may sanitize it themselves, but we really don't see the need to sanitize that bowling alley.
So they closed it on their own. The health department of the New York City government had nothing to do with that.
No, we did not order them closed.
Okay, so they're doing it on their own. Because the question is, if you're going to do that, then why not sanitize a restaurant? Why not sanitize a train? And on and on.
Right, and we did not do the bowling alley.
Right. What about his apartment building? Because their health officials were at his apartment building earlier and in his neighborhood handing out pamphlets and information on Ebola. But we are told by our doctors, Dr. Devi, if I'm correct, this virus can live on surfaces for a number of hours, but it is not transmitted through the air. It's not airborne, but it can live on surfaces for a few hours. What's a concern, though, in the apartment building with elevator keys, that sort of thing, door handles, and that is that a real possibility?
I don't know that it's a real concern, because the thing is, it's true that the virus can live on surfaces, but it's only for a short period of time. I mean, and you have to think about how much virus is actually in these bodily fluids. So if he didn't have symptoms, then the likelihood that anything is in these fluids is very low. Plus, even with his keys, he left the keys inside the apartment, right, because he didn't want anybody to come into contact with them. So I think he was taking a lot of precautions. I mean, the thing that I would wonder about more is the healthcare workers at Bellevue. But I think the fact that he's a doctor himself, he might be able to assist with some of the invasive procedures that they would do, where there would be more bodily fluids.
Do you want to follow up on that, Mr. Esposito?
Yeah, again, you know, the Department of Health is going to go into that apartment, take a look around. Is there any fluids that may have he may have spilt in the apartment? But as far as the hallways, the elevators, again, he's not symptomatic until he goes by ambulance to Bellevue today. So the likelihood of anybody being infected by him prior to him showing symptoms is very, very slim. Doc, I think you know that.
So, Mr. Esposito, you said if you're not, you don't think that the risk is that great. Then why are you wanting to track his movements? If you don't think the risk is that great, and you don't say you're not going that far beyond, but I mean, tracking someone's movement on the subway, that's, again, that's very intensive.
Yeah, well, we want to be cautious. We don't want to just be negligent either. We're going to quarantine the two fellas that he was bowling with. We're quarantining his fiancée, and now we're quarantining the girlfriend of one of those friends also. They were
Is she in the
contact with
hospital?
him.
Is she the one who's in the hospital?
No, the fiancée is at the hospital now. She'll be staying overnight.
Okay. And so far, no one but the doctor showing signs of Ebola, right?
That's correct.
Okay, the fiancée is not.